Hello everyone, and welcome to Restorative Health Solutions. If you understand what's making you sick, then you can start to understand how to get better. More information is power. Hello, I'm Dr. Warren, and today I want to talk about Lyme disease and pregnancy. This is a question that I get pretty frequently, and I think it's a very hot topic. It was even more in the past. I think it's calmed down a little bit, and we'll talk through some of the reasons why. But the most important thing to know is that chronic Lyme is officially real. It's taken 30 years of advocacy and fighting, but in 2022, the CDC and the NIH, if you looked at their stuff, still said Lyme was not real. It was pseudoscience and pseudomedicine. And then in 2023, chronic Lyme was real. The acknowledgement after years and years of fighting that it's a real thing really changes some of this pregnancy argument. Because what we're really worried about is, can the chronic Lyme be transmitted down to the fetus and down to the baby? And if it can, then there's a danger for not just mom, there's a danger for baby, that baby will not be as healthy as we want baby to be. When we're dealing with pregnancy, the history of this argument is that because Lyme's a bacteria, we need to do things to protect baby against the transmission. Now, both sides on this argument historically, the reason this fight gets so hot is both sides have taken the moral high ground. So the Lyme advocates goes like this: because Lyme is real, we need to be very proactive ethically to protect not just mom, but now to protect baby. Now, the other side, which is your conventional medicine side, for years said because chronic Lyme is not real, it's not a thing, it doesn't exist, these people are all faking it, giving therapy for Lyme during pregnancy is ethically irresponsible and a problem. In fact, all these doctors who are treating people during pregnancy for Lyme are putting the pregnant person in harm's way. So both sides will argue that because they're right, to treat or not treat during pregnancy is unethical. And it all hinges around, well, is Lyme real or is Lyme not real? Because if Lyme's real, then not treating is unethical. And if Lyme is fake, then treating is unethical. And we came to the conclusion 2 years ago that it's real. That realization that Lyme's real should then trickle down to, okay, well then you need to do something during pregnancy. Now, none of the policies have been updated or changed since that happened. Really, only thing that's happened since the CDC and NIH acknowledged Lyme is real. None of the testing recommendation changes, none of the protocols have changed. The only thing that's changed is there's more research happening. So they're funding more research to look at it more. That's really all that's happening practically. This is as of summer of 2025, almost 2 years later. So the big question is, can Lyme or chronic Lyme be passed down from the pregnant mom who would have the infection down through the fetus to the baby? The answer to this question is unequivocally yes, both from a theoretical and a practical point of view. So number one, this happened to me and my family. So we have kids who, my wife had it, who passed it down to kids. And so we've had to fight it not only in my wife, we've had to deal with this in kids. Once they got old enough to start testing them, we found, exposures and antibodies and these other tests that are positive for tick-borne illness. So from a practical point of view, I'm kind of living proof of this. I have multiple patients where it just happens. From a theoretical point of view, these are blood-borne pathogens in the body. I don't know how you wouldn't pass it to the fetus if you are sharing blood for 9 months. The next question is, how dangerous are these things, or what are the symptoms during these things or phases? So when we're dealing with chronic Lyme, not the acute Lyme, you don't have the same dangers of active, quickly growing infections. And so for the most part, they lead to more chronic problems than acute problems. So we don't expect it to raise a lot of acute problems in pregnancy or delivery or young childhood. But you can get chronic problems. You can get health issues as they grow up, either neurologically or joints and muscles and things like that. And these can be hard to distinguish in young children because young children can't communicate as well. We could have whole segments on treating stuff in kids and risk for PANS or PANDAS or how it looks developmentally in children. That's not what we're talking about today. We're just talking about pregnancy. So absolutely, positively, it can transmit. And we now accept that it's real. And so we do want to be doing something while people are pregnant or before they're pregnant, ideally, in order to help clear it so that we can have babies as safely as possible. What are the symptoms during pregnancy if you have Lyme? Most people, from my experience, most people who have chronic Lyme actually feel better temporarily when they're pregnant. So because the immune system has to shift to not hurt baby, because remember, baby is foreign, it's not you. And so your immune system has to shift to not hurt the baby. That's a natural, normal process in pregnancy. And as it makes that shift, oftentimes what happens, also the hormones go up. And so between the hormones going way up during pregnancy and the immune system having to shift to not hurt baby, most of the time the inflammation during pregnancy actually calms down. And many of my Lyme, chronic Lyme patients, many of them feel just fine during pregnancy. All right, we maybe have some of the normal pregnancy things like nausea or morning sickness, but really during pregnancy, they do not have, for the most part, a different experience. And some of them actually feel better because of this inflammation shift. Now, the big problem comes after they've had the baby. So postpartum, your immune system swings back, your hormones come down, and we get this big inflammatory push as your immune system kind of re-engages after the baby. Now, this is especially confusing to first-time moms because you don't really know how you can feel. It's very hard to describe to a woman what it's like to be a mom when you've never been a mom, and what it's like to not sleep and have, breastfeeding and just having a baby all the time for the first time is hard to describe to someone who's never had it. So you get this postpartum that's really, really rough. You can get this postpartum depression and this stress and this pain, and the Lyme disease amplifies that and kind of makes it off the charts. And so my biggest concern in my Lyme and tick-borne patients is this big swing back in the postpartum, not really complications during the pregnancy. Because these are slow-growing chronic forms, that's the biggest risk that I see and that I try to mitigate and deal with. Okay, so what can you do during pregnancy to help fight Lyme disease? Now, this is a very hard question because we do not study pregnant people. And so many of the medications, even if they use them in pregnancy, have not been studied on pregnant people. Supplements and herbs have not been studied on pregnant. We don't do studies on pregnant people. We laugh when there's prenatals that say, don't take while pregnant. There's just not studies done on prenatal people. Even think like there's categories, there's like A, B, C, D. There's varieties of different ways to categorize safety. Not even things like Tylenol are in category A, which is like, we have studies and they're proven safe. So, there's almost nothing in category A for pregnancy because we don't run studies on pregnant people, right? So when a woman is pregnant, we want to err on the side of being safe. Now, because my wife was pregnant in and out of getting Lyme, or we figured out she had Lyme about 2013, and she was pregnant while we're trying to get her better, I had to come up with, okay, of all the different protocols we're doing, how much of this stuff can you safely do while pregnant? How much of it can you not? And using a variety of herbal safety books and 400-page reference books, look through every herb, look through every protocol and see what you can do. So I understand why doctors want to treat with high-dose antibiotics during pregnancy, because once again, we're trying to protect baby. But there's a downside to high-dose antibiotics, meaning you are definitely screwing up gut flora, and you're definitely promoting yeast problems, and there's risks. You can have liver problems and other complications of being on multiple high-dose antibiotics for long periods of time. And so I think there's a downside to doing the high antibiotic protocol while pregnant, mainly setting baby up for some health problems with just unhealthy gut flora. So This is another situation where I think you can do the herbs much safer and a natural protocol much safer while pregnant while still being proactive. Now, it's true about a half to 2/3 of the herbs we don't use while you're pregnant. So we don't use oregano, for example, while you're pregnant, right? We don't use wormwood while you're pregnant. So there's lists of things that I will use and lists of things that I won't use. And we'll kind of run through, okay, here's things you can do while pregnant. Now, it's important that I tell people it's not ideal to try to fight Lyme while you're pregnant. The better way would be to try to get rid of it and clear your system and then get pregnant, because trying to do it while you're pregnant, I don't have as many moves. I don't have as much flexibility. It's a little bit like fighting a fight with, one hand instead of two, right? But it still can be done. There are certain herbs that are considered safe while pregnant or given traditionally while pregnant that have much higher safety profiles. And I think by going through that, I've helped several women while we're doing this, including my own family, to try to be proactive while still exploring their family. Because one of the things that's really real, guys, and this was us too, was, we had 2 kids. My wife was very sick, and we kind of had this, like, we don't know if we can have more because my wife was just so sick. And I remember talking with her and saying, look, I married you. I want to spend time with you. And the kids are great, but I didn't marry you for the kids. I married you for you, and the family is, a natural part of that we enjoy. But thankfully, she got better. And once she got better, we had, a family discussion, and the Lord blessed us with 2 more kids. So we have a total of 4. They're spaced out a little bit just because that's the way life happened to us. But it's been a blessing for, our family to have each other and have some of that space, create some fun dynamics. So if you are in and around pregnancy, struggling with Lyme disease, just please know there's absolutely things you can do to be proactive, both for your own health and your baby's health. And it's not necessarily an increased risk factor for pregnancy because of the chronic long-term state, but it absolutely makes life harder in the postpartum when you usually get the swing back. And absolutely, there's risk factors for baby because these are bloodborne illnesses, and so we can pass it on to baby, and then their immune system has to deal with it their whole life, right? Which can have some chronic negative consequences too. I'm Dr. Warren, and I hope some of this information on pregnancy and Lyme disease was helpful to you. Thank you.